Today's video is all about tearing. We're gonna see together what can be done to prevent or better reduce the chance to have a tear during childbirth, even starting from pregnancy. Let's go into the video. Welcome back, future parents. My name is Ilenia and I've been a midwife for the past 6 years plus, helping women all over the world achieving the best pregnancy, birth and postpartum journey. Today's video we're going to talk about tearing in particular, with the focus of what can we do if there is something that we can do to reduce our chance of having a tear during birth. If you have not watched the other video about tearing, please stop this one and go to watch that one now. I'm gonna link it here, where I explain what a tear is, what it happens, what kind of tears we can have, and comparing it with an episiotomy. In this video, we're gonna go and see instead what can be done during pregnancy and during the second stage of labor, meaning when we start to push the baby out. Just to do a little recap on perineum and pelvic floor. The pelvic floor is the kind of like hammock structure that supports our internal organs during all our life, and during pregnancy is even put under more stress due to the uterus and the weight of the baby together. So it's a bunch of muscles that we don't mind too much during our life, but they really have an important role during our life and during pregnancy and birth. During birth, they're also even more put under pressure because there is the pressure of the baby's weight going through the vaginal canal ready to come out. So is there something that we can do to help to prepare these muscles during pregnancy? Yes, there is something called perineal massage. It is really a little bit controversial in terms that there are studies that really support the use of perineal massage during pregnancy in helping reducing the chance of first, second, third degree tears. Others are really instead, they're not very clear. They say that they might reduce one type of tear, they might reduce episiotomy, they might reduce third or fourth degree tears, but we're not very sure. My advice is that if it's something that you feel comfortable to do and it might help and it might give you some peace of mind that you've done everything in your possibility to prevent tearing, then definitely do it, because it's one of the practices that does not cause any harm unless it's done wrongly, and I'm going to tell you how can be done in this video. So what you want to do is when you're 35 weeks onward, you want to do it 2-3 times a week for like 3-5 minutes a day. You want to make sure that you have your hands clean and your nails trimmed, and you basically just put both thumbs, using even an organic oil, coconut oil or a vitamin E based oil. You want to put both thumbs in the bottom part of your vagina, down here. You want to put some pressure down for 30 seconds and then go up on the sides, like making a U shape for another 30 seconds. I'm going to show you with one thumb so you can see a bit better. So you put both thumbs down here, putting a bit of pressure for a few seconds, and then you go up on the sides. You want to do it when you're nice and relaxed, sitting on the sofa or on bed. If you want, your partner can do it for you, especially if you feel very big with your tummy and it's quite hard to access that area. Whatever makes you feel comfortable. It just helps those muscles to get a stretch and a little bit of massage, and helps the circulation and helps the preparation for childbirth. Evidence also say that, adding to the fact that it might prevent tearing in birth during birth, it can also reduce the pain that you can feel in that area in the postpartum journey. It can shorten the length of the second stage, meaning the time where you're actively pushing, and also helps you to get more comfortable with that area, especially if you need to care about the perineum. It's going to help you to understand where that area is and how to get it clean and healthy. The situations where I would not encourage the use of, actually I would probably say that it's not indicated for you to do perineal massage, is if your waters have broken, or if you are active bleeding, and I think you're not going to be there massaging if you're actively bleeding, or if you have a vaginal infection going on like thrush or something that by inserting fingers and external things in the vagina, you're actually increasing the chance of spreading the infection. Besides those indications, everyone can do perineal massage. Do it as much as you like and as much makes you feel comfortable and prepared. But let's go and see what can be done during labor and especially during birth to reduce the chance of having a tear. My number one tip is to actually dive a little bit more into depth and asking about what are the statistics of episiotomy and tearing in the hospital or in the place where you're gonna give birth. Also know your provider, your midwife or doctor, if you get the chance to meet them and to know them before, especially if you are under a caseload team, like if you've seen you're the same team of midwives during your pregnancy or the same doctor during your pregnancy. Do ask them what is their rate of episiotomy or of tearing, if they encourage different type of positions, and I'm going to tell you why, and really what they do to prevent these complications that they can happen, because it really gives you an idea. The second tip to prevent tearing, as I was saying, is to adopt different positions during the pushing part. This means that you can change position to help the baby to descend, but you really want to avoid all these positions laying on your back, like semi-recumbent or lithotomy position. Now, sometimes they work, and there is no problem if you do a few trial of pushes in that position, but you really, for the last part when the baby's coming out, you really want to avoid being on your back. This is because the pressure of the head is just gonna be aided by the gravity in order to put more pressure on the perineum, and therefore laceration and tearing can happen more often in that position. What you want to do, my two best way to go positions are all fours and hands and knees and side lying, right or left according to what position your baby has. Like a skillful midwife is able to understand what position side lying is better for you. In terms of like sitting in upright positions, they're great in terms of getting baby down and helping baby descend. For the very last pushes, I would adopt one of the position I was talking to you about, so or hands and knees or side lying. This is because you want to avoid the baby coming out very, very quickly. And this links me to tip number 3. Wait and let for your perineum to stretch by itself. I talked about this in the other video, so again, make sure you watch that one first. But the perineum needs time to stretch, and then it needs that pause between the contraction to get more oxygenated, to get more blood in the area, and then to stretch again. If baby comes out with a very high speed, then your perineum does not have time to do that, and then it can go towards more severe laceration. So how do you do that? You do that by blowing and not pushing. If you have not seen the video where I talk about breathing in labor, make sure you go to see that one as well, because in the very last pushes, when you have the ring of fire, when the pressure of the head is at the maximum, then you want to actually pause. You want to give time to your perineum to stretch, as I was saying. You want to breathe the baby out and not actively pushing. You do that by don't pushing actively this way, like, but breathing the air down into your body and into your vagina like a J shape. This will allow baby to kind of come out by itself and giving time to the perineum to stretch. You will also hear your midwife saying, blow, blow, don't push, blow, breathe, just because we really want the baby to do the last part by itself, helped by you, but not with a major effort of pushing. You've done that already. Pushes are great to get baby down, but in the very, very last part, you want to breathe the baby out. You can also talk to your midwife in terms of using warm compresses on your perineum. This practice simply means applying pressure with the hand and a gauze soaked into warm water, not hot. Your midwife will know what's the best temperature. And to kind of support the perineum during the contractions with applying this warm compress. This is because the warm water really increases vasodilation and increase the flow of oxygen to the area, and therefore you decrease the chance of tearing in that way. In terms of a hands-on approach or hands-off approach, which means really when the midwife is giving support to the perineum, either with or without a warm compress, if your midwife is giving support with the perineum, I would highly encourage to ask to use a warm compress. But anyway, that's as well, we have different studies in terms of what is better. There are studies that says that does not change the incidence of perineum. Other study that says that it actually helps reducing first or second degree tears. So again, just talk to the midwife and see what is gonna help in your situation. Personally, if I think that the baby is coming very quickly out and mom is not able to control the breathing, I would help and slow down a little bit the descent of the head by putting my hand on top of the baby's head and supporting a little bit the perineum to avoid, as I was saying before, the head coming out very, very quickly. But if it's something that you don't like, again, just say, because they're all your rights and you should be listened to. Last tip that I want to give you is to actually let it go. I don't want to use the word relax because it's impossible to relax during those moments. But what you really want to do is to leave the tension and the muscle exercise there in that moment. Leave it be, let it go. Unfortunately, higher chances of having a tear are seen in those women that have done a lot of exercise to their perineal muscles. I'm talking not about perineal exercise, but like athletes or ballerinas, women that during their life have been taught to use the pelvic muscles a lot for sport reasons. This is because they're not able to let go in that moment. You actually have to surrender to the power of nature and what's happening down there. You will also instinctively kind of close the legs in those last moments, just to give a little bit of time to the perineum to stretch, as I was saying before about blowing and breathing the baby out. So your body knows what to do if you listen to your body. Try to put aside the idea that you can control everything, especially that moment, because it's really a moment where you have to trust your instinct, trust your body, let it go, and let it do what nature knows what to do. It's all for this video. I hope it was helpful. As always, make sure to subscribe to the channel and like the video. I'll see you next time. Bye bye.